Hello viewers, welcome to our channel JD Pharmacoveda. In this pharmacology classification section, let's continue the classification from non-steroidal anti-inflammatory drugs, drugs which are used for the treatment of rheumatoid arthritis, and drugs which are used for the treatment of gout. So first of all, this non-steroidal anti-inflammatory drugs. So this is an important classification from many questions can be asked. So in that, the most of the drugs are COX inhibitor. So COX is an enzyme which convert arachidonic acid into prostaglandin. Prostaglandin plays many roles in our body like inflammation, fever and etc. So first of all, the non-selective COX inhibitors drugs. First, the salicylates, aspirin, propanoic acid derivatives, ibuprofen, naproxen, ketoprofen, chlorbiprofen. Then phenamate, mefenamic acid. Then enolic acid derivatives like pyroxicum, tenoxicum. Then acetic acid derivatives like ketorolac, indomethacin, nabumetone. Then pyrazolone derivatives like phenylbutazone and oxyphenbutazone. Then next category is preferential COX-2 inhibitors like nimesulide, diclofenac, aceclofenac, meloxicam, etodolac. Then particularly the selective COX-2 inhibitors like celecoxib, etoricoxib, paracoxib. Then next category is analgesic antipyretics with poor anti-inflammatory action. So first of all, para-aminophenol derivative, the drug is paracetamol or acetaminophen. Then the next derivatives are pyrazolone derivatives, the drugs are metamizole, propofenazone. Next category is benzoxazine derivative, nefopam. Then the drugs which are used for the treatment of rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease that causes pain, swelling and stiffness in the lining of the joints. So particularly the inflammation in the synovial membrane is caused by the release of cytokines such as TNF-alpha, interleukin 6 and interleukin 1. So the drugs can be of two types: disease modifying anti-rheumatoid drugs, DMARD. So there are two classifications: non-biological drugs and biological agents. So the non-biological drugs, the important drugs are immunosuppressants, methotrexate, azathioprine, cyclosporine. Next drug is sulfasalazine, chloroquine, hydroxychloroquine, leflunomide. Then the biological agents like TNF-alpha inhibitors, the drugs are etanercept, infliximab. The next drug is adalimumab. So the next category is interleukin 1 antagonist, the drug is anakinra. Then the other category is adjuvant drugs, that is the steroids, prednisolone and other glucocorticoids. Then the next classification is drugs used for the treatment of gout. Gout is a form of inflammatory arthritis that causes pain and swelling in the joints. So when the gout occurs when monosodium urate crystals build up in joints, bones and soft tissues. So the drugs can be acute and chronic. So for acute gout, the drugs are NSAIDs, colchicine and glucocorticoids. In chronic gout or hyperuricemia, so we know that the accumulation of uric acid in the big toe or the joints causes the gout. So uricurics are the drugs which increases the excretion of uric acid in urine. So the drugs are propanacid, sulfenpyrazole. Then the synthesis inhibitors like allopurinol and febuxostat. Thank you for watching. If you like our video, please like, enter your thoughts, clarification, doubts in our comment section, share with your friends and subscribe to our channel.